What is pulsus paradoxus? It refers to more than 10 millimeter mercury drop in systolic blood pressure during inspiration. When would it happen? It will happen in conditions like cardiac tamponade, but it can also happen in asthma, COPD, hypovolemic shock, and constrictive pericarditis. Constrictive pericarditis. So think about it. All these conditions, what are they trying to do with the heart? Basically, when you have cardiac tamponade, what happens? Triad of hypotension. So you'll have hypotension, you'll have elevated jugular venous US pressure, and what else you'll have? One, two, third was muffled heart sound. So a muffled heart sounds. So you will have hard time listening heart sounds. Okay, so Beck's triad, also known as Beck's triad. Okay, so pulsus paradoxus is important physical finding in cardiac tamponade. Why? Because it's exaggerated drop, as I mentioned earlier, for more than 10 millimeter mercury during inspiration. What happens? Fluid accumulates in the pericardium. So if fluid is accumulating in pericardium, what's gonna happen? You think heart is gonna have good time? Imagine this is your heart. This is the heart. Okay, left ventricle, and this is a visceral and parietal pericardium and fibrous pericardium. There is fluid right here. Fluid. So if fluid is right here, you think heart is gonna expand easily? Heart is gonna have hard time expanding. So sometime when it contracts or expand, like when blood is coming, there is gonna be problem because sometime fluid is gonna move here. So there's gonna be issues with the heart contractility. So this will lead to exaggeration of this more than 10 drop in systolic blood pressure. Because you are uh, decreasing the left ventricle and diastolic volume in this situation. Why would you decrease left ventricular and diastolic volume? Imagine blood is coming here, goes to the left right atrium, and then pulmonary system, then comes to left atrium, and then here, right? But because of this accumulation, right ventricle expansion has been limited, so it cannot expand. So if it does not expand, what's gonna happen? Not enough blood going into the system. So not enough blood going into the system. This will result in decrease blood pressure in the system, especially systolic pulse during inspiration. Why during inspiration? Because your thoracic pressure decreases during inspiration, which results in increased venous return. Increased venous return will result in what? So increased venous return right here, venous return, inferior vena cava, venous return comes here. It's gonna push the septum further over there. So your left ventricle, right ventricle and right atrium, they're going to push the septum over there. So your ventricle is already having hard time here. It's been not allowed to expand as much as it wants, and now you're pushing your septum even further over there because of increased venous return. This results in even lower ejection fraction, right? So decreased ejection fraction will result in pulsus paradoxus, which is again more than 10 millimeter drop in systolic pressure. Okay, now I'll explain something else as well. So what is pulsus alternan? So pulsal alternan, it refers to, look at its name, pulse alternates when, right, beat to beat, so beat to beat there is going to be pulse change. Why would it happen? It will happen because of change in systolic blood pressure, and when it will happen, left ventricular dysfunction again. Listen, electrical alternate is like a pericardial effusion or cardiac tamponade issue again, because you know when you have, this is your heart, so when your heart is in this fluid, heart is pretty much swinging. So when it swings, it cannot function as it wants to do it. So that will result in change in amplitude due to change in systolic pressure. So it is commonly seen in patient with left ventricular dysfunction. Left ventricular dysfunction, again the situation pathophysiology I sort of explained earlier. You have fluid not letting it expand as much, so each time the beat is differently beating. Now I'll explain one more thing. Hyperkinetic pulse. Hyperkinetic pulse. So what is hyper and what is kinetics of pulse? Okay, hyperkinetics of pulse. It's basically rapidly rising pulse with high amplitude. Rapidly hyperkinetic, rapid, right? Fast. Rise in pulse with high amplitude. So why would it happen? Because there will be rapid ejection. When will you have rapid ejection? When there is more blood in the heart, or when there is less blood in the heart? This is my question. Think about it. Answer fast. This can happen in when there is more blood, because you know Frank Starling, increase blood, increase contraction. So you have a situation like aortic regurgitation. You'll have more blood, usually, you know, left ventricle. This is your heart. Right atrium. So what happens? Usually left ventricular output is what? So end diastolic volume is like 120 and systolic volume 50. 120 minus 50 is 70, so you'll expand 70. But then if it's aortic regurgitation, blood comes back, some of it, and then there is more blood coming from left atrium, and then there is blood coming back from here. So it's going to be rapidly fill the left ventricle. Faster the left ventricle fills, more blood inside it is, the rapidly and harder or strongly it's going to contract. So next time more blood goes out. Instead of 70, might be 18 going out. 80 millimeter of mercury, 80 ml of blood is actually going outside. Not the pressure, the volume is going to be more. Okay, obviously pressure is going to be more too, but I'm talking in terms of volume. So more blood going out. So hyperkinetic means rapid rise in pulse with high amplitude. Why high amplitude? Because next time more, instead of 70, you have 80 ml of blood is going outside rapidly, because more blood, left ventricle fills faster, so it sends blood out more faster. So hyperkinetic pulse, rapid rise in pulse with high amplitude. Frank Starling, think of more blood. Aortic regurgitation bringing more blood. So in this situation you have hyperkinetic pulse. One last thing, sorry. Okay, so I want to explain about what happened in aortic stenosis. Aortic stenosis, what happens? You have obstruction